What less common risk factors cause bladder cancer? Imagine uncovering hidden factors that might increase your risk of bladder cancer beyond the usual suspects. While smoking and chemical exposure are well known, several less common factors also play a role. Chronic bladder irritation from repeated urinary tract infections, bladder stones, or long-term use of urinary catheters can cause ongoing inflammation. This persistent irritation may lead to cellular changes that increase cancer risk over time. In some regions, drinking water contaminated with arsenic has been linked to higher bladder cancer rates because arsenic is a recognized carcinogen that can accumulate in the bladder through urine. Certain medications, like the chemotherapy drug cyclophosphamide, and herbal supplements containing aristolochic acid, found in some traditional medicines, have been associated with increased risk due to their toxic effects on bladder cells. Previous radiation therapy to the pelvic area for other cancers can also raise the chance of developing bladder cancer years later by damaging bladder tissue. Genetic and hereditary factors, although not the main cause, can influence risk. For example, Lynch syndrome, a DNA mismatch repair disorder, and Cowden syndrome, involving mutations in the PTN gene, can modestly increase susceptibility. Variations in genes responsible for detoxifying harmful substances, such as NAT2 and GSDM1, may also interact with environmental exposures to raise risk. Birth defects involving the bladder, like uricus remnants or bladder exstrophy, are rare but can predispose individuals to cancer due to ongoing irritation or infection. Race and sex also influence risk, with men and white individuals experiencing higher rates, though the reasons are complex and involve both genetic and environmental factors. Low fluid intake can concentrate carcinogens in the urine, increasing exposure to harmful substances. In regions where the parasitic infection Schistosoma haematobium is common, chronic bladder inflammation caused by the parasite significantly raises bladder cancer risk. Other environmental exposures, such as contact with opium, certain dyes, metals, and petroleum products in the workplace, may also contribute to risk. People with a history of bladder or other urothelial cancers are more likely to develop new or recurring tumors. In younger patients or those without typical risk factors like smoking, the causes are less clear, and ongoing research suggests possible genetic links or associations with other cancers, highlighting the importance of personalized risk assessment. Understanding these less common factors helps us recognize the complexity of bladder cancer development. If you have concerns or multiple risk factors, talking with a healthcare professional can provide personalized advice and screening options. Remember, staying informed and proactive about your health is key to early detection and prevention.